Welcome back to the show, Dr. Eric Smith. Now, I want to jump straight into it. Let's talk a little bit about the Georgetown Community Hospital and its robotic surgery excellence.
So we've been doing robotic surgery for about 4 years now. We do more robotic bariatric and general surgery than anybody in the state of Kentucky. We do around 600 cases a year and treat a variety of pathology with it.
All right. Now, we've talked about it before on the show. What is robotic surgery? You're still performing the surgery.
Correct.
You're
Yeah.
you're just utilizing the machine.
Right. Robotic surgery is 100% surgeon driven.
Okay.
There's no robot that moves without the surgeon doing it. It's the terminology that we use for the technology that we're using.
Right.
And so what it allows us to do in a minimally invasive way is to improve things that we were already doing laparoscopically. Our vision's improved, our dexterity is improved, tissue handling's improved, blood loss is lessened, and all those things.
We like all of that. Now, what are some of the surgeries that are performed that you typically do with the robotic surgery?
So some of the common surgeries that I do is obviously all my bariatric or weight loss surgeries I do robotically.
Okay.
We do colon resections. We do complex hernia surgeries through that way. We can do something basic as a gallbladder removal as well.
Really?
But bowel resections, foregut work, for reflux and hiatal hernia surgery, all those are done robotically.
Okay, let's just jump back to colon because, of course, March is Colon Cancer Awareness Month. You said colon what?
Resections or removal.
What is that?
So if someone has a colon cancer, the primary treatment for colon cancer is to remove that portion of the colon that has the cancer in it or the tumor. And then there may be some further treatment after that. So, you know, unfortunately still in 2019 there's lots of patients being opened, large incisions, to have this surgery done, and that's not necessary.
Why do you prefer to use robotic surgery as to the normal way of doing surgery?
Well, you know, if you're, you know, what's the normal? That's open or laparoscopic. So I did these laparoscopically before I did them robotically.
Okay.
So anytime you can do something in a minimally invasive way, it's better for the patient. You know, does somebody want to go back to work in a week or two, or do they want to go back to work in 2 or 3 months?
So you're saying less downtime?
Absolutely. So patients, colon resections that are done open oftentimes are in the hospital 3, 4, 5 days. Most of my patients go home the next day. Most of my patients can be back to work in a week or two. That's a big deal. That's not even considering that you have decreased problems with wound complications, hernia risk, wound infections. All those things are reduced when we do these surgeries robotically. So it's better for the patient.
Okay, now you're a master of this machine and the robotic surgery. You go around and teach a lot of other hospitals and surgeons. Why do you want to do that?
Well, it's obviously I have quite a bit of experience in it. So the company that makes the robot, Intuitive Surgical, utilizes me for that, as far as educating surgeons that want to start robotic surgery. Maybe they're surgeons that have a lower experience and want to increase their volume, do it on more complex procedures. So I have surgeons that come watch me operate, or I go to other places to teach surgeons how to use the equipment.
Okay, where do you see the future after this robotic surgery? Do you see it going somewhere else?
Well, robotic surgery is going to continue to grow. It's in other specialties that I don't do, in spine, in orthopedics. It's starting to become prevalent in all those specialties, whether people want to adopt it or not. That's where it's going. And it's always robotic assisted. It's always going to be surgeon led. But if we can take something like an essential tremor away from a surgeon who already does a good surgery but makes their hand perfectly steady all the time, which is one of the benefits of the robot, why would anyone not want to do that? Now, if the surgeon doesn't know where to put his or her hand, then that's a problem, but that's not a robot issue. That's a surgeon issue. So when you put this technology in people who have a lot of experience and do a high volume of this like we do, your outcomes are going to be superior every time.
Is there a cost difference? Is it an option? Do you see what I'm saying?
It's an investment made by the hospital.
Oh,
it's a big investment made by the hospital, but it's not an increased cost to the patient. Because at the end of the day, the hospital's job is to provide the very best outcome for a patient. If they do that, it's going to be profitable for them.
And that's what you all do over there at Georgetown Community Hospital. You're amazing. We think you're great. Again, thanks for great information. If you want to find out more information about Dr. Eric Smith or Georgetown Community Hospital, everyone, all the information is up on your screen. Back after this short break.